Hello, this is Dr. Lewerenz at Longevity Health Institute. Good afternoon. Actually, I'm shooting a video from literally where I sit and work every day and deal with patients, talk to patients on the phone, go down the hall, visit patients here, and give them what I believe and what most of my patients would tell you would be the best in integrative functional medicine. Personalized care, looking at root causes, looking at details, how to fix and heal you with compassion and passion and caring. So today here where I sat, I thought I'd tell you this story and share with you this story that a cardiologist called me about a patient, and obviously I can't say patients' names and that, but a very prominent cardiologist in the area at Beaumont Hospital, where I'm on staff at, called me and wondered what I did with a patient that we mutually share, because something miraculous happened, and I thought that I would share this with you because it's kind of common. We actually do it here. When we come across a patient, unfortunately, that has some cardiac issues, and I don't play a cardiologist, I actually use wonderful cardiologists around the area. I know many of them personally that do wonderful care in that, but sometimes it takes a little bit different toolbox to tweak things, or to at least look at somebody individually at a personalized level and to see what might be missing that can help. So this gentleman that actually the cardiologist called me about was a 60-plus-year-old gentleman that experienced some unfortunate events in his life with electrocution. He had a head injury, seizures, and that led to a multitude of medical issues, disability, etc. And we're doing many things with him, hormonally, nutrient-wise, gut-wise, digestively. But one of the things is that from some cardiovascular developments that he's had, he developed a very low ejection fracture, which is essentially, in lay terms, is a weak heart. The heart muscle does not contract and squeeze efficiently. So the amount of blood pumped with every squeeze of the heart is not as what it could be, or not near 100% of its ability. And there's a lot to do with theoretically what seems to be on testing and echoes, etc., a damaged muscle. Just if you damaged your bicep or your quads and your legs or your glutes or your triceps, if you damage that muscle would be weaker. So in this gentleman, he had a low ejection fracture, something called cardiomyopathy. His ejection fracture was around 30-35%, which is significantly low, almost 50% reduced from what is normal. And he had, of course, low energy, etc., related to what you can imagine is low cardiopulmonary health and fitness and that. So two simple things we did with him that at least give him a chance. And we're talking about quality of life issues here, and this is why I wanted to share this story with you is because not only what did he call me, the cardiologist, and talk to me about, and I shared with him, but the patient himself and his wife shared with me was very touching and very moving, because some wonderful things happened to this gentleman in his life that I feel very special to be a part of. But the things that I did was this. I gave him a certain type of magnesium glycinate and malate. And that type of magnesium, which we use very frequent here at Longevity Health Institute, has the ability to give you muscle relaxation. So the heart's a muscle, no different than any other muscle in your body. And when you relax the muscle, the ventricular chamber can fill more with blood. So that squeezing ability of the heart, you're going to get a bigger pump function, essentially, from each contraction. So I put him on a low to moderate dose of magnesium glycinate and malate, and tried to optimize his levels of this, which they have other wonderful benefits. They help bowel relaxation, bowel function. You'll go to the bathroom a little bit easier. You can sleep a little bit better if you take a higher dose at night, but you split dose a little bit in the morning, a little bit more at night, okay? The other thing I gave him was a medical grade supplement called nutraceutical called CoQ10 or ubiquinol. Now, there's different forms of this, ubiquinone, ubiquinol. You want to get a fat-soluble CoQ10. Ubiquinol is fine. It's a little bit cheaper than a ubiquinone. It has to convert, but it is adequate enough as long as it's fat soluble and it's actually supplemented in a oil fat soluble form so that it's essentially in a fat. You take it with a meal, this way you get excellent absorption of it. I put him on 300 milligrams of this. You can go 300-400 milligrams, split doses 2-3 times a day. And that essentially is the fuel, or if you will, the gas, the feeder, okay, as an antioxidant that helps ATP to the mitochondria of every little muscle cell. Your heart's a muscle. So you're essentially feeding fuel, okay, to this man's weakened, damaged, atrophied, damaged heart muscle. And so he'll get better pump function, or better what we call ejection fraction. So CoQ10, that's fat soluble that you take with food, magnesium glycinate malate, the heart fills, the heart contracts much better. So this is what happened with this gentleman since we've done this. He actually saw his cardiologist, had a repeat echo, and his ejection fraction went up about 10%, even pushing upwards of 15%, okay? So he went into the 45 to close to 50% range of ejection fraction, okay, which is nearly normal, okay? And the cardiologist said to him, whoa, what are you doing? What's going on? Didn't tell him to stop, called me, wanted to know my input, what we did with him, was thrilled, just said, keep up with what you're doing because obviously you're feeling good, his energy's good, his heart function and pump function's better, so amen, God bless him that this stuff's happening. And without harm. These are all wonderful things for your body. Your body needs these nutrients, it lives on these nutrients so that you can thrive and not just struggle and survive. And these are the two wonderful things that happened to this gentleman. One is that he, per his wife, not just him, his wife was in the visit, his wife's a nurse, actually reported that his energy levels, 30-40% most days, even up to 50% better. Okay, and again, this is in a 60-plus-year-old gentleman with heart disease. And he's doing stuff more around the house, he's awake more, he's more active. Mind you, I told you in the past, disabled, not able to work even, okay, in the past. I think for approximately the last 8-10 years, okay? His son, their son, just got married, went to the wedding, first time in decades, he got on a dance floor and danced, had a lot of fun, had a couple drinks, he said, had people following him around the dance floor so he didn't fall and trip over. But God bless him, he had a blast, had energy to do this. People around the dance floor clapping, loving him. He had a great time and couldn't feel better about it, and they were thrilled about this. And that warms my heart because these are things that I'm passionate about, not just to bring health and wellness, but also to bring vitality and quality of life issues. There's a lot to be said about quality of life, okay? We're not just here to struggle, okay? So these are wonderful things I think this family and this man experienced from simply looking at somebody functionally at a personalized level and supplementing some things that he needed that just optimized things in him. Didn't take him off any medicine, didn't play cardiologist. Cardiologist appreciates me, I appreciate him, and we're doing wonderful synergy together. So I just want to share that with you. Hope this enlightens you. Share with others with any heart, blood pressure, vascular issues, cardiomyopathies, weakened heart muscle issues. Obviously talk to your doctor, come see a functional medicine doctor, practitioners like ourselves here, Longevity Health Institute, and we'll do the right thing for you and look at you first doing no harm, but optimizing you to the best you can be. Again, Dr. Lewerenz, be well.